Congressman, let me switch gears to Obamacare and, of course, the House vote today. The Republican-led House under pressure from President-elect Trump to both repeal and replace that legislation. Paul Ryan confirmed this plan. Listen to this. I want to get your reaction.
We are in complete sync, and we agree. We want to make sure that we move these things concurrently at the same time, repeal and replace. We need to show that there's a better way forward.
Do you believe Republicans can actually work with Democrats to pass new legislation? And is there a replace after this repeal?
Well, we're going to be inclusive with the Democrats in this process. Not the question of repealing, but how we fix a broken system. Maria, years ago, 7 years ago, when the Democrats were doing this without Republicans in the room, we tried to offer things. We knew that there were programs that were already in place that we could have included. We certainly agreed on a few areas, certainly pre-existing conditions and portability, but we were locked out. So we're going to, and the Speaker has made a commitment to make sure the process is open, but at the same time, it actually puts the affordable in the Affordable Care Act.
Congressman Leah Gabriel here, we were talking about Russian hacking, and the way I see it as a former human intelligence operator is that was, essentially a Russian cyber ops campaign is what's going on to sort of divide us here in the United States. So moving to the repeal and replace, as long as Republicans are trying to repeal without really giving paperwork, giving documentation, a plan that can actually go through the process of legislation, don't you think it's further putting that divide here in the United States that Russia wants anyway?
Well, I'm not going to give Russia the credit for anything other than being the I want to be relevant evil country on the other side of the world, actually on almost half the world. But when it comes to how we have to do the process, yes, we're going to use reconciliation to begin the process of dismantling a system that's broken. That's exactly how it was created, and no apologies there. But just as the Affordable Care Act was phased in over a number of years, we're going to be phasing out many of its parts over a number of years. And I think that's the important message is we're not afraid to have it take 2, even 3 years, as some senators have said, but we want to begin the process of letting you get that doctor you used to have that you want to get back again. We also want to deal with the fact that the Affordable Care Act had no tort reform. It didn't do anything to lower the cost of health care. It subsidized health care, but subsidized health care is simply a matter of shifting from one pocket to another, an ever-increasing cost. And that's what Speaker Ryan is pushing for, is he's demanding that we have solutions that help lower the cost and maintain the availability. Yeah. And we're going to do that.
Real quick, Peter.
One of the things I haven't heard, during Obamacare, the two biggest providers, United Healthcare and Aetna, walked away from the business, saying, we don't want the opportunity anymore. What are you doing to reach out to the people who have left and say, we want to bring you back into the new plan?
Well, those two carriers are a big part of the Federal Employee Health Benefit Plan, which has over 8 million individuals on it, basically federal workers and their family. And one of the proposals that I had then, and that I will be presenting in the next 2 days, is, in fact, the return of the proposal that all Americans have access to that very large plan. If you were to take pretty much all the people that are not on the Medicaid side of Obamacare and put them into FEHBP, it would only a little bit more than double the size of that massive program. So scale is already there on an alternative where you have over 250 different plans to choose from in every state in the union.
All right, we will leave it there. Congressman, great insights from you as always. Thanks so much.
Thank you, Maria.
We'll see you soon. Congressman Darrell Issa there.